I didn't watch a lot of Simpsons growing up, but good Lord, Bart Simpson. Oh, no, no, no.
Ludicrous!
I think it's hilarious. I would love to have a cap that I can just unscrew and just shoot toothpaste at people. I think that would be the greatest superpower for a dentist. This is Dr. Tarab Rai. We're gonna be looking at some Simpsons clips today. Would love your support. Like, comment, subscribe. Show this to someone that has some funny dental experiences, and hopefully we can educate the community together.
Let's look at a picture book. The big book of British smiles.
You know what's funny is I think every dentist has a big book of British smiles in their brain, and it's just our job to try not to judge people whatsoever. People have weird circumstances that come up in life.
I'm also afraid little Lisa is going to need braces.
Oh no, I'll be socially unpopular. More so.
Here's Lisa today. Without treatment, here's what she'll look like at age 11, age 14, age 17, and finally, age 18.
Wow. I like how these teeth are somehow getting bigger, even though permanent teeth don't do that. This dentist is definitely a fearmonger. If you come across a dentist that's a fearmonger, I suggest looking around. It's not gonna get that bad. I always tell people, like, you can keep the teeth that you have. Okay, you don't have to lose them, they're not gonna go crazy. Just take care of them.
Cool, she'll be a freak. Bart, we can stick her in a trailer, drive her around the South, and charge 2 bits a gander.
The funniest part about that too is the amount of humor that my patients have about their oral health is amazing. They're incredible human beings. Every single time someone comes in, they're like, you know, they have a smile that needs a little bit of help. The jokes that I hear from their spouses and from their kids, their cousins, all that stuff, it makes a drastic difference in my quality of life, because I get to be like, yeah, I understand you're going through stuff. And then I get to present them a solution that makes them look absolutely amazing.
Let's just get started.
Oh my God, my gums! They hurt so much!
I haven't started yet.
I know, but a breeze from that window went in my mouth.
If you have sensitivity like that, you need to go to a dentist ASAP. I know you're afraid, and I know you don't like the noises, I know you don't like the sharp instruments, whatever, but like, at the end of the day, if you can avoid for 15 minutes of your life to take care of yourself, you're going to have much, much better quality of life. I like that they put the drill sound right in the beginning, because that's like exactly what every single person is thinking. The drill might be scary sound, but at the end of the day, it's the education and the trust of the person that you're looking for.
Go! Ow! 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 You butcher!
Don't worry, sweetie. I'm sure that man has some special tooth problem.
I don't even have a special tooth problem. This is just a routine checkup.
Yeah, so whenever I come across a patient like this, I have a very serious conversation with them, and I say, listen, there's other people in the building. I understand that you're afraid, but there is no reason to be speaking loudly. Overreacting, oftentimes a dentist has done a lot of treatment. Don't overreact, okay? Life is like a lake a mile wide and a foot deep. So just step into the lake, get it done, and get out of there.
It's over? That wasn't so bad. Damn, baby got bacteria. You want to stick it to these whiteys?
Hey, I'm down with OPP, ongoing periodontal problems. Break it down.
Hey, you low-life degenerates, stop illing with the filling.
Ludicrous!
Periodontitis is actually inversely correlated to having cavities. So the bacteria oftentimes that cause gum disease are not the same ones that are going to cause a lot of cavities. I think it's hilarious. I would love to have a cap that I can just unscrew and just shoot toothpaste at people. I think that would be the greatest superpower for a dentist.
Here's a free toothbrush. Keep those teeth clean. So you're saying I should do your job for you at home for free. You wish.
Just lie completely at ease while I administer the nitrous.
I shall.
The dentist will be here in a minute. He'll know exactly what he's doing. Don't resist in any way.
We may need to replace a tooth. I'm gonna take an x-ray, so lie perfectly still for 20 minutes.
I didn't watch a lot of Simpsons growing up, but good Lord, Bart Simpson. Oh, no. No, and to a point to that, guys, communicate with your dentist. Please communicate with any doctor, communicate with anyone that you are that have a fiduciary responsibility to fulfill what you want done, right? You got to communicate. You're gonna know your health a lot of times about as well as we are, right? We have the education, but you have the personal insights on what's actually going on.
Lisa, so you won't be scared, I'll show you some of the tools I'll be using. This is the scraper, this is the poker, and this happy little fellow is the gouger. Now, the first thing I'll be doing is chiseling some teeth out of your jawbone. Hold still while I gas you.
Guys, nitrous oxide is not a psychedelic, okay? This is not in any capacity how nitrous oxide works. If it was, we would have a lot more issues when we're doing dental care. In fact, we're not allowed to provide dental care to people that are mentally, their cognition is blocked by any sort of drug. So if you come into the office and you're like super stoned, there's a very good chance the dentist is gonna say to you, listen, like you should reschedule. I don't think you have the mindset to actually provide proper consent for your treatment. Also, as far as show, tell, do, that's the thing that they tell us in school for pediatrics for kids. You got to show them the instrument, you got to tell them what it is, and then you do it. It does work, okay? And most of the time, the instruments that we're using on children, we're not gonna end up showing them like the needle. We're gonna say it's sleepy juice. You can say these things and show these things in a much more effective way than this socially compromised dentist is showing you.
Honey, you look fine.
All right, so for those of you that don't know what that device is, that device basically allows you to change how your jaws are positioned, and it actually makes a big difference in the lives of people that have their jaws fairly established. Just realize that it's a skeletal thing that they're changing. It's not necessarily having to do directly with the teeth. And usually it's used for cases that are pretty severe, which the Simpsons in general, they tend to have very small jaws. So that's probably why the dentist and the inside joke is there. Thank you so much for watching. Like, comment, and subscribe. If you want more of this stuff, and if you have any comments in general, we do answer those. So take care of yourself, hoping you the happiest of smiles. If you want to see more stuff like this, you might like this video. It's a good one. Check it out.